Hello, my name is Alfredo, and today we're setting up a room here for a Barium Enema exam. So we're going to go over a little bit about what we need. You're going to need a Barium Enema kit, which comes with high density barium already in it. This particular bag here will hold about 500 milliliters of water, which we will mix into it. You want to use lukewarm water, roughly around 85 degrees to 90 degrees Fahrenheit. It'll make the patient feel a little more comfortable and make your exam flow a little smoother. Going to need some KY jelly for the tip, for the insertion tip. We're also going to need some gloves, hemostats for clamping, and some towels here. We'll go over a little bit on the stuff that's hanging up over there. But first, we're going to go ahead and just get our kit here mixed up. So we're going to use 500 milliliters. I'm going to try to make minimum mess up. I already started. You want to go ahead and just add your 500 milliliters of water here, and then we're going to shake it for about 30 seconds. I'll let this go down here. Also, what you're going to want to do before your patient walks in, you want to have everything set up. So we're going to bleed our line, meaning that we're going to run our contrast through the line to get rid of all the air and have it set up for the patient to come in. And that's about 500. Go ahead and clamp it off. Clamp off on the bottom. Then you go ahead and just use your hemostats as well. Do a double clamp here. Alright, so you go ahead and shake it for about 30 seconds. Get this nice and mixed. Okay, so now that we have mixed for 30 seconds, we're going to bleed our line here and get all the air out of our line. Make sure we get just the barium in there. We don't want to introduce more air into the patient. So we go ahead and open it up. You'll let it run until we get the air out. Okay, here we go. There it goes. So once it's there, make sure that you don't run it back, because that's what I'm doing. Keep recording. All right, we clamp off there. That's what you want your hemostats for. Clamp it off in the bottom. And we're ready to go. Now that we've cleaned up ourselves and our mess that we made here, we have our insertion tip, which is going to be this one, which is attached to an air infuser, which you're using for double contrast study. You can infuse air into the patient once the tip has been put in. Got your KY jelly, which you're going to lubricate. Make sure you use plenty of it. And also, you have your inflator cuff, which when you push in, inflates to about 90 mils of air. Usually the radiologist will do this, but there are occasions when you as a technologist might have to do it as well, so just be aware of that. All right, so we have our room all set up. We got everything set up to go, so I'm going to go ahead and grab the patient. Right over here. Mr. Beckett?
Yes, senor.
Hello, sir. Tim?
Hola.
Hi, can I get your date of birth, please?
December 11th of 83.
All right, well, nice to meet you, sir. Right this way. My name's Alfredo. I'm going to be doing your procedure today, all right? So, are you aware of what we'll be doing today?
Not a whole lot. What's happening?
All right, so what we're doing on you today, sir, is going to be it's a barium enema. So what we're going to do is we're actually inserting a rectal catheter tip into your rectum and inserting contrast in there, barium contrast. And then the doctor's going to come in. He's going to turn you around a few times, get that barium, to coat your gastrointestinal tract, your large intestine. And then after that, we're going to do a couple of pictures, so I'll be turning you around a few times. It is pretty uncomfortable, sir, so I do apologize, and we'll try to make it as quick and comfortable for you
Gotta
as
do what
you
you guys
can.
gotta do, I guess. Yeah.
Yes, sir. All right, so have you had this procedure done before?
I have not.
Okay, so this will be the first time. All right. Mr. Beckett, do you know why we're doing your procedure today?
Not entirely. I've just been having a lot of pain.
Okay. In this case, Mr. Beckett, if he was a female, we still have to ask Any chance of pregnancy? Would there be any chance of pregnancy?
Nope.
All right, well, let's get started. All right. Head right over here. You're gonna go ahead and lay on my bed here, head towards the pillow. We're gonna start off with the scalp KUB, which is gonna be just to make sure that everything is nice and clear. Now, Mr. Beckett, did you follow all the instructions of the cleansing and all the instructions to?
Yeah, it was terrible. Basically peed out of my butt for 2 days.
All right, so low fat diet for 2 days. No breakfast this morning.
No breakfast.
All right.
No food really.
All
Just
right.
have you drinking crap.
Well, sir, I'm sorry to hear that, but I'm glad you followed it. So scalp KUB, basic KUB, center at the top of the crest, which we're here. You want to shield your patient. Pretend that's a shield. Put one there. All right, sir. Perfect. Go ahead and take a deep breath. Blow it out. Hold it. Expose. And we're set. So we'll move on to the next one. All right, so we have given our image to the radiologist. He has taken a look at it, has said that it is okay to go ahead and continue with the procedure. So, Mr. Beckett, please go ahead and turn on over to your stomach right now. At this moment, I'm going to insert the tip. There you go, sir. Perfect. Go ahead and bend your right knee for me. There you go. All right. I'll give you a little sheet here. Cover you up here. In this case, he's wearing pants, but normally they wouldn't be. We're going to cover him up here. Have your lubricating jelly, so you're going to go ahead and just drench this bad boy in KY. All right. Bring your clamp down close to the tip. All right, sir. This is going to be a little uncomfortable, and I apologize for that. So go ahead and take in a few breaths for me, please. Deep breath. Blow it out. All right, with one hand, with your hand, you're going to lift up the right cheek. Getting clear access. You're going to go in about 1.5 to 2 inches originally. Then heading up towards the belly button. So here it goes. So ready? Deep breath. Blow it out. Go in 1 inch. Then go up towards the belly button there. No more than 4 inches. Doing okay, sir?
Yeah.
All right, relax. All right. So at this point, either we can inflate the cuff or the radiologist can. So I'll just go ahead and do it. Then you clamp it off. All right, and we're ready to start. All right, our second shot is going to be a PA axial, 30 to 40 degree angulation of our tube. I'm going to come out this way, make sure you remain detented. There you go. Since we have an angle on our tube, go ahead and adjust your bucky to match the angle. That's about right. This is a sigmoid rectum shot. Cone down to about a 10 by 12, which is what we'll be using. Centered at the as is, which is right there. It's a good shot, sir. Go ahead and just hold your respiration. And expose, go ahead and breathe. Right, the technique that we'll be using for Mr. Beckett here for this lateral, or for the axial sigmoid, we'll do about 100 at, I want to say 32 perhaps. Right? Okay, so now we're going to move on to our next shot, which is going to be PA projection, and we'll be doing a LAO, RAO position. So, Mr. Beckett, go ahead and just, make sure you align your tube here with your bucky, sir. Go ahead and bend your left leg for me, please. There you go, perfect. Just relax right there. We're going to center our film 14 by 17, left side marker closest to us. Adjust your film. Centering at the top of the crest. And you're going to come in about midways from the spine to the lateral side. And in this case, since we're oblique, we're going to be foreshortening. You can cone in a little more if you would like. Sir, go ahead and take a deep breath. Blow it out. Hold it. And expose. Sir, go ahead and relax. We'll move on to our next one. Go ahead and bring your leg out this way. Bend your right knee for me, please. And right there, perfect. Do an elbow, make sure we're good. Centering it once more, top of the crest. Midways between the spine and the lateral side. Left marker still on my film. Sir, go ahead and take in a deep breath. Blow it out. And hold it. And expose. Go ahead and breathe. Alright, so we're moving on to our next one. We're going to do a cross table rectum. In this case, we have our film set up here, 10 by 12. We have our right side marked, which is the side closest to the patient here. Alright, Mr. Beckett, just hang tight, almost done. Maintain your distance of 40 inches, 40 to 48 inches. Center. You want to make sure you collimate to what you need, not the wall. You start off at the wall, but then move down a little more. There you go. You do the top of your film. Is the top of the film top of the crest? Mr. Beckett? Do you remember? I think it was top of the film, top of the crest. Yeah, that's good for me.
That's what I would do if I was a student.
Good job. We're going to use our technique about 100, 110 at, I want to say, 40 is lateral rectum. And sir, go ahead and just hold your breath and expose. Go ahead and breathe and relax. So since we have our tube here in the cube, go ahead, sir, turn on to your left side completely. Always be aware, be conscious of where the tube is. Want to make sure it doesn't come out since our patient is moving around a little bit. All right. So you want to go ahead and center at the top of the crest, which is about there. Perfect. And he's pretty close to the film. Go ahead and move our film here. If you want, you can also center a little bit lower. We do have our patient here propped up on a little cushion, so we ensure that we get all of the left colon. All right. Center, top of the crest. That's good right there. Left marker is not on because it's the right side that's up. So the right marker is on. All right, so go ahead and take in a deep breath, blow it out, and hold it, and shooting. Go ahead and breathe. All right, sir, now do me a favor, go ahead and roll on over to your left side, your right side. So go ahead and turn all the way around. Let me help you here with this tube. You're doing great, sir, almost done. Perfect. And I have changed my film. So now he's the left side. The left side is up, so now we're going to go ahead and mark our side. Left side up. Once more. Make sure that he's in a true lateral position. There you go. Knees are bent, so he's doing very well. Almost like he knows all this. Center of the film, top of the crest. Center ray, top of the crest. That right there looks good. Center a little bit lower to use that divergent ray. Make sure we get everything in there. Sir, taking a deep breath. Blow it out. And hold it. And breathe. Okay, so now we have gone through our series here. We're going to have our last shot, which is a post-evac. I'm going to remove the tip here. Go ahead and come down to your stomach, sir. Perfect, there you go. Make sure you deflate the cuff. Sir, I'm going to pull this tip out of you, okay? Go ahead and just take in a deep breath for me, please. Blow it out, and there you go, sir, perfect. I'm going to give you some towels here. And I need you to go on over to the restroom. And yeah, you're just going to get rid of as much as you can, okay? And then come back, we have one more shot. Thank you. So we are now in our post-exam, so we're going to start doing our overhead shots. Doctor has gone through and done the procedure. Since Mr. Beckett here is in a prone position, we're just going to go ahead and continue with our exam as is. So what we're going to do is we're going to do one PA shot. Since the left side is closest to me, my film is marked with the left side, closest towards me, center at the top of the crest. we have contrast now, barium contrast, so we're gonna do a higher kV, anywhere ranging above 90, so we're probably gonna do about 110 for Mr. Beckett here for kV. So center at the top of the crest, sir, go ahead and take in a deep breath, blow it out, and hold it, expose.
All right, so now we're gonna be doing our evaluation criteria of our images that we took on our Barium Enema. You can see here we started off with our Scout KUB, which basically is your basic KUB centering at the level of the crest. Want to include the down to the bladder, down to the pubic symphysis, up all the way to the diaphragm. That way you ensure that you get the left colic flexure here, since it will be the highest one. You want to make sure you include all of that. Radiologist takes a look at this just to make sure that everything is clear and that the patient followed the instructions given to him as a pre-setup. So let's go on to our next shot here, which was our left lateral decubitus position. On this one, we have the patient laying on his left side, and as you can see here, the descending colon is shown, is the area of interest here, as well as the ascending colon. The medial side of the descending will show the air side here, so you can see, visualize any details better than you would on the lateral side. And on our right ascending, the lateral side is the side of interest here, with the air being clearly shown there. Our next image was the LPO AP projection of the oblique rectal, the rectal sigmoid. Is it LPO AP oblique? Here we are visualizing the rectal sigmoid area, which is going to be here. We're elongating the sigmoid and the rectum, so getting them free of superimposition as best as we can. And we move on to the next one. No, I did not. That was the other one. Okay, so this one is the LPO axial AP. So everything that I just said was for this one. So I'm gonna evaluate this one as if it was the last one. So the other one is the LPO. So what we're looking at here is the right flexure, which should be opened up here on the right hepatic flexure, and also the ascending colon is the area of interest in this image. This is our basic AP, which pretty much similar to just the KUB that we did earlier as a scout. As well, you want to make sure to include all the way up to the everything of the large intestine, large colon, all the way down here. And this one just shows exactly where all the contrast is at this time. RPO AP oblique. On this one here, we are focusing on the left splenic flexure, which should be opened up, and also the descending colon, which comes around this way. That's our area of interest, since the left side is the side up. And that's what we're looking at when we look at an RPO. And this one here is our right decubitus position. Patient is laying on the right side, and we are looking at the lateral side of the descending colon, as well as the medial side of the ascending colon. You can see some there. See some air here. That's what we'd be looking at on the right side. And the left side, the descending colon is right on this side. You can see it there. That's our area of interest for this particular shot. The cross-table lateral rectum, our area of focus is the sigmoid area here towards the rectum shot here. This is what we want to see. That's a good shot there. And our final one is our post-evac. So this is after the patient has been detipped, I would say. So everything has been pulled out. The patient is able to go to the restroom and just evacuate his or her bowels, and then come back. We do one last KUB shot, and it's expected to see some contrast in here. So we just want to make sure that everything is okay and where it's supposed to be. And that is it. That's the evaluation for the BE trigger images.